So my name is Carmen Arth, Dr. Carmen Arth. My pronouns are she, her, they, them. At Concordia, because I'm at Concordia University, and I love it there. We have this really positive wellness orientation. And often I think it's just us. And so finding out that other people are really focused on wellness and working hard to support their students, for me, it gives me a breath of relief that it's not just us, and that I can learn from other people, and that I can share it with other people. And it also gives me ideas about research collaborations. Peer support is incredibly impactful because people find out that other people feel things that they feel that they've stigmatized themselves for or pathologized themselves for. And other things, they think it, they feel it. And so it's not just us, and that's so liberating.
I started with the Caregiver Project in April 2017 at the beginning, so I was the caregiver facilitator at the time. Caregiver Connections here in Wood Buffalo are coursing that help you to understand maybe what's going on for a specific diagnosis possibly. They're caregiver support coursing in regards to creating that peer support network so that you understand that even though your challenges might be different from somebody else's, unique to the individual that you're supporting, the feelings and the fears and the challenges that come up for us are similar. And so that we can support each other in that. You build a different relationship when you're having those really deep conversations with someone who is also able to understand your fear and your the sadness, the grief, all the things that come with watching somebody you love in pain, whether that be emotional pain or physical pain. And so that addiction or mental health experience that in caregiving is really important to recognize that it's unique, but you're not alone.
Integrated Youth Hubs project is a model that creates coordinated access, which means low to no barrier access to existing community resources, treatment, and services for youth and young adults in each community. So the level of community engagement from the young adults and the youth in the community has been really rewarding. And to know that, there have been some success stories of youth reaching out and parents reaching out and being able to direct them to somewhere that fits them. So it's all about finding the right provider with the right service at the right time. To see that bigger change and how that filters down and influences those youth and young adults in the communities is just so, it just makes my heart happy.
I began the project in early 2021, just as a participant in peer group support. And a couple months into it, the peer group leader asked if I would like to become a facilitator, which I've been doing just very briefly now, but enjoying it. There is that massive stigma, especially I'll speak exclusively for myself, in policing, of you're bred and brought to believe that you have to have this macho persona in order to facilitate your job, and it makes it even more challenging to seek help. I think that's extremely important that people do a combination of the one-on-one therapy and peer group support. And peer group support is just, you can see people change, and you can see how it almost becomes a pseudo family because we're all bonded by similar experiences and helping each other get through life.
My name is Jen Yerkew. My pronouns are she, her, and I am the provincial recovery lead for the Recovery College project. Recovery College program has and continues to offer so much to community across Alberta. There is an opportunity for people to really dive into, explore their own recovery journey and explore it from the lens of learning and curiosity. And it really positions people to be in that driver's seat. People can take that learning, that growth, their own experience, and then translate that out to be able to help support people in their journeys moving forward. And yeah, I think that that's, to me, a really great example of what the impact of this program can really have.
My name is Ilya Ushikov. I use he and him pronouns, and I'm the provincial peer lead for the Recovery College project. The wonderful thing about Recovery College is that it is all the courses within it are co-developed. And what that means is that the facilitators and the organizations have really chatted with community members and made sure that a lot of lived experience is embedded within the content. And there's the opportunity to really share and learn from each other in a peer-based model. And that peer-based model that's co-facilitated, and it really builds that community. And I think that's the most impactful piece of the Recovery College. A lot of the people that come into it, they begin with taking one course, and then all of a sudden they become part of that community and they want to give back more, and they share everything that they learned with their friend groups, and then kind of creates that grassroots movement that really provides a lot of that social change and really builds a healthier community.
I was born and raised in Grand Cache. We have some really good services here. We don't have a newspaper. We don't have means to really advertise or anything like that. I, myself and Yvonne even have really been trying to like break through that with people and just say like, you know what, like so-and-so is really good at this and this person's really good at this. Why don't we just all come together and volunteer our time to just do it? There is lots of things that we can do. I want to do like a ways to wellness for Grand Cache. It's going to be kind of like practices. So, you know, be kind, practice gratitude, eat healthy foods, get active, be yourself, get your groove on. I want it to be much more than going to FCSS or coming to CALP or going to mental health. And well, there's this services and there's these pamphlets and I want it to be more authentic and more real and connection to people.